Hello viewers, I am Dr. P.K. Das, Senior Consultant Medical Oncologist working at Apollo Hospital, Delhi. Today we will be discussing the recent advances of treatment of liver cancer, otherwise called as HCC. This is hepatocellular carcinoma. It's a primary cancer or malignancy of the liver and occurs predominantly in patients with cirrhosis or chronic liver disease, which could be secondary to alcohol abuse, chronic viral hepatitis B and C infection. It is the third leading cause of cancer deaths worldwide. The incidence of this malignancy is highest in Asia and Africa. These patients often present with right upper abdomen pain, weight loss and signs of compromised liver function. The treatment recommendations are, in early stage resectable disease, we could do partial liver resection and liver transplantation, which may be curative. The resection is recommended in patients who have a preserved liver function, generally with early cirrhosis without any portal hypertension. When the patient comes with unresectable disease, we generally go for liver transplantation or, if feasible, try for locoregional treatments which should be employed before systemic treatment. For unresectable limited disease, the treatment options are like ablation, which could be radiofrequency ablation, cryoablation, percutaneous alcohol injection or microwave therapy. The transarterial approach or the chemoembolization could be a radioembolization or through chemotherapy. The stereotactic body radiotherapy and the external body therapy today are recommended in selected patients. The systemic treatment recommendations for these unresectable or advanced metastatic disease in patients with early cirrhosis are oral sorafenib, which could be given 400 mg twice daily, and the patients were previously treated with sorafenib, we can think of the newer drug called regorafenib, which can be given 160 mg once daily for 3 weeks followed by 1 week off period. The newer drug nivolumab is a immunotherapy which is given in 240 mg every fortnightly, as per the NCCN guideline, which recommend that only limited options or support the use of chemotherapy. The regorafenib in hepatocellular carcinoma, which was approved in April 2017 by US FDA as a second line treatment option for hepatocellular carcinoma who have already received sorafenib. This drug got approved in hepatocellular carcinoma as per the phase 3 resource trial, and this resource trial was a multi-center international randomized double-blind placebo-controlled study done over more than 570 adult patients with advanced hepatocellular carcinoma who had progressed on sorafenib. This study showed there is increase in overall survival and progression-free survival with regorafenib, and the most common adverse effects associated with regorafenib were manageable hypertension, mild hand-foot skin reaction, fatigue and mild diarrhea, which can be given with a controlled with a symptomatic treatment. The newer treatment is immunotherapy. The US FDA recently got an approval of nivolumab for the treatment of SCC, and this drug, regardless of the PD-L1 status, we can use. This approval is based on the tumor response rate and the durability of response as seen in the CheckMate 040 trial. According to this trial, nivolumab had a manageable safety profile in patients with advanced hepatocellular carcinoma. Now the targeted therapy for the hepatocellular carcinoma as a next line, they are evolving. The two new lines of TKIs called lenvatinib and cabozantinib got recent approval. This lenvatinib is an oral multi-targeted receptor tyrosine kinase inhibitor. It got an approval by US FDA recently for the other usage of the thyroid cancer and as well as in advanced renal cell carcinoma also. The FDA has recently accepted a supplemental new drug application for lenvatinib as a frontline systemic treatment for patients with advanced hepatocellular carcinoma. The application for this drug lenvatinib was based on the finding from a phase 3 REFLECT trial. The other drug is cabozantinib, which is another oral inhibitor, tyrosine kinase inhibitor approved by US FDA for the renal cell carcinoma, and for the medullary thyroid cancer also. In a phase 2 trial, 41 patients of hepatocellular carcinoma were done. Results were encouraging. In this phase 3 celestial trial, which is ongoing, which can use cabozantinib as a monotherapy. Thank you and goodbye.